Actually, I always tell my patients, right, everyone has nasolabial fold. Only monkeys don't have. Even very young children and babies can have nasolabial fold.
Laugh lines, also called nasolabial folds, are those lines that run from the sides of your nose to the corners of your mouth. You might notice them even when your face is at rest. So why do these lines appear, and is it just aging? In this episode of Ageless Uncovered, where we invite doctors to unpack knowledge on different topics, today we have Dr. Lam, Medical Director of Ageless Medical, and Dr. Vera, Assistant Doctor of Ageless Medical, to join us to explain the real reasons behind laugh lines and what we can do to reduce them. As usual, we'll start off with a myth or fact section. So the first statement we have for the day for Dr. Lam: aging is the main cause of laugh lines and only older people get laugh lines. Is it a myth or a fact?
It's a myth. Okay. Actually, I always tell my patients, right, everyone has nasolabial fold. Only monkeys don't have. Even very young children and babies can have nasolabial fold, and sometimes it's due to our bony structural defects. Especially Asians, we tend to be very flat in our mid-face. Sometimes we're even retruded in our mid-face, so we tend to have nasolabial fold. And of course, coupled with aging, the laugh lines can get worse because as we age, we lose fats in the middle part of our face. Not only that, the facial ligaments in the medial part of our face become lax, and these facial ligaments hold up the fat pads. So when the facial ligaments become lax, the fat pads starts to descend, and when they descend, it will worsen the nasolabial fold. Then of course, with repetitive facial movements, you laugh a lot, you smile a lot, that will also accentuate your laugh lines. So laugh lines can happen when you're very young. It can get worsened as you age due to all these factors.
I see. The other statement that we often hear is weight fluctuations worsen laugh lines. Is this a fact or a myth?
So this is definitely a fact, okay, because what happens when we lose weight, all right? When we lose weight, the fat in our mid-face actually is lost, and hence you make these folds more prominent. And similarly, weight gain can actually stretch the skin, therefore deepening the laugh line. So what is worse is, when people have very quick weight fluctuations, what I term as the yo-yo weight, that can actually result in accelerating the skin laxity, making these nasolabial folds or laugh lines more prominent.
I see. Another statement that we often hear is that laugh lines are just purely cosmetic. Is it a fact or a myth?
It's a fact because it doesn't reflect any underlying medical or health concerns at all.
Okay, now let's dive deeper into what actually causes laugh lines and why they appear even when we are not smiling. So Dr. Lam, what causes laugh lines?
I've already mentioned everyone has some form of laugh lines, whether they are deep or they are superficial. Very often, it could be due to congenitally your bony structure on the face, the support is not so good. So you can have laugh lines that are deep and static. If your mid-face especially is very retruded or very flat, you can have dynamic laugh lines that only appear when you laugh and you smile due to maybe your muscles in the mid-face. We call it the zygomaticus minor, major, and risorius being very hyperactive. That itself, when you laugh and you smile, will make your laugh lines appear more obvious. And of course, if you're very animative, you laugh and you talk a lot, you smile a lot, the repetitive movement itself can cause you to have actually what we call static laugh lines that are also there when you don't smile. Then I've also mentioned earlier, when we age, the facial ligaments become lax, especially the facial ligaments that hold up the mid-face fat pads. And when they become lax, the fat pads will descend. And when they descend, it will accentuate your laugh line. So these are the many factors that can actually worsen your laugh line and makes it appear even when you're younger.
I think we mentioned the laugh line is just purely cosmetic, but what can we do if we really don't like it? What are the treatments available in the clinic that we can help with laugh lines?
I think a lot of us can agree that, the mainstay of the treatments are still injectables, but I think everybody is very different. There are some of my patients who come in and they say, hey, I'm really, really not ready for injectable. Is there something that we can try, an alternative? So my alternative to them is there will be energy-based devices. Okay, so things like our Therapy Prime, which is my favorite.
Therapy Prime.
as well as the end phase. But I always tell them that, hey, with artery prime and end phase, it can only minimally or at most moderately improve these laugh lines.
Yeah, absolutely. I think we have to manage the patient's expectation. If they expect the energy-based devices to completely eradicate the laugh lines, I think that's not possible. And as Vera has pointed out correctly, at the end of the day, very often laugh lines need to be treated with injectables. So one very common treatment that we always do is dermal fillers. So dermal fillers, we can use it to actually fill the laugh lines. Either static, we inject deep into the alar base, and dynamic laugh lines, we can inject very superficially, very small quantity so that it don't look weird. Sometimes you can also use this regenerative injectable skincare that has both a high and low molecular weight HA that we inject in this area that is hollow. We call it the preauricular hollowness, because by injecting here, we can have a very nice lifting of the jawline, and sometimes it can also lift a little bit of your laugh line and your puppet line, or we call it the marionette line. And then with that, patient not happy, they can put a little bit of dermal filler, either deep at the alar base or superficial at the dynamic laugh lines. Another treatment that we can do to help somewhat to improve the laugh lines, sometimes in certain patients, especially of gummy smile, I can actually inject a little bit of botulinum toxin very strategically into these muscles. We call it the LLSAN, or the levator labii superiores echinaceae muscles. They can help to relax this. It can bring down the gummy smile and improve the laugh line a little bit. So these are the various options that we can do to treat laugh lines.
Sounds very complicated. I think it requires a very good injector to make sure that the laugh lines can be treated properly also. So I think it's very important for you to find a good doctor for this treatment. So anything to add on for laugh lines?
I think, many times my patient come to the clinic, I'm sure Vera faced them too for the past 2 years. They will come chasing lines. So they come in telling us they are not happy with this line and they want this line treated. But the underlying issue of this line, we've already explained, due to many other underlying problem or underlying causes which we have to treat. So the patient have to be realistic. We will explain to them and tell them what kind of treatment we can achieve, what kind of results, and then to manage expectations.
And I think that with that, we can wrap up today's episode. Why do we get laugh lines even when we are not smiling? A big thank you again to Dr. Lam and Dr. Vera for helping us to understand the real reasons behind nasolabial folds and why they can appear even in younger people, and how lifestyle, genetics, and skincare play a role. Remember, while laugh lines are a natural part of facial expression and aging, you can still do something about it here at Ageless Medical. So remember just to visit a good doctor and a good physician for your laugh lines concerns. If you enjoyed today's episode, don't forget to like, share, and subscribe, and see you in the next one.
So like what you said, at the end of the day, consult your friendly aesthetic physician that will do a proper facial assessment for you, discuss with you all the treatments available to actually target your concern.